Okay, we arrived. Here's our patient. Our scene was safe when we arrived on scene. We're gonna make sure we use our PPE. Never know in times like this. I'm gonna get a general impression of the patient. She looks normal. Everything. Don't see any bleeding. Nothing really immediately of concern. She's alert, verbal. Hello, hello, hello. She's verbally responsive. Her pain response is normal. So she is responsive. I'm gonna ask you a couple questions, ma'am. Do you know what your name is?
Yes, Amber.
Amber Schwartz?
Yes.
That's a good guess. Do you know what day it is?
Yes, it's June 14th.
June 13th. Are there any holidays coming up? Any birthdays?
Yes, my birthday's tomorrow.
It's tomorrow. Oh, happy birthday. Pre-birthday. So her mental status is good. She answered the questions fine. Her tone is good. Her speech is good. And she's interactive with me, so that's good. I don't see any labored breathing, adequate breathing, so that's good. Her posture, she's in the supine position now, but when she was standing, it was normal. Her skin color is normal. It's dry. It's warm. It's pink, so that's good. Airway, I'm gonna check your airway, man, and see if you. Airway's good. No obstructions. She's got a patent airway. Let's see. I'm gonna listen for breathing. Make sure she's breathing. Yes, she's breathing. Her chest rise and fall is adequate and normal. I'm gonna check your carotid pulse, ma'am, to see if she's got a carotid pulse. Her pulse is strong and beating between 60 and 100 beats per minute. I'm gonna check her radial pulse. There it is. It's good, adequate, being at a normal rate. So as of now, there's no need to immediately transport the patient. So we're gonna move on to our secondary assessment. I'm gonna ask you a couple questions, ma'am. Have you had any symptoms recently?
No, just a little bit of pain.
Just a little bit of pain when I pinched you?
Yes.
Okay, that's normal, totally normal. Allergies? Do you have any allergies?
No allergies.
No allergies. Medications?
No, just my prenatal.
Just for prenatal, and you took that today, correct?
Yes, I did.
Good. Any past history that I need to worry about of illness?
No.
No. What was your last oral intake, ma'am?
It was about 1 o'clock today. I went to Banana Bud and had a salad and tea.
That sounds delicious. Any events leading up to this that I need to know about?
No.
Alright. Now I'm going to palpate and do a head-to-toe exam, starting at her skull, working down to her pelvis, and then checking her extremities. I'm going to start with the scalp, and I'm going to check for bruising, blood, fluid, coming out of her nose, ears, mouth, what have you. Seems normal, normal head, maybe on the small side. Yes, no, nothing in her ears, nothing in her nose. Her mouth looks good. Could you open your mouth, ma'am? Tongue is normal. Nope. I'm gonna check her pupils for see if they're reactive to light. See if they constrict. They do constrict. So they're reactive to light. That's good. Her neurological functions are good. Her nervous system. Now I'm going to work my way down to her neck, checking her trachea. It's midline, which is good. No deformities. No jugular vein distension. So that's good for circulation. Might as well check her carotid pulse again. Beating, average, good, good. Any stiffness or tenderness in your neck?
No.
So her spine, her cervical spine feels in line, feels normal. No deformities. No tenderness again here.
No.
Check your clavicles. Your acromioclavicular joint. Is that okay?
Little, it helps a
It hurts from pinching it earlier. I'm sorry. I'm going to go ahead and go through her chest. Check for bruising. Any abnormal chest rise and fall. Pull my stethoscope out here. I'm going to listen to your breathing, starting with your apical and working my way to your axillary and finally your posterior.
Okay.
To see if your breathing, lungs, breathing sounds good. You take a deep breath in, man. Take a deep breath in. You take a deep breath in. I'm going to listen to your posterior. We can sit you up. You take a deep breath in. Okay, good. You can come back down. So they're normal lung sounds, normal breathing sounds. I'm gonna work my way down now to checking your abdomen. There. Let me know if there's any pain or tenderness. So I'm going to check your upper quadrant here, check the liver, check the stomach in the upper quadrant, check her kidneys, no pain, bad feeling, alright, no bruising it looks like she's got a baby in there. Seems to be a healthy baby in there, that's good. I'm going to check her lower quadrants now, her stomach, or her colon, and her bladder. Still no pain or tenderness. It's okay? Okay. I'm going to check her pelvis here. Feels okay?
Yes.
Good, good. And now I'm going to move on to her upper extremities. I'm going to check your motor and sensory functions here. So if you look away, can you tell me what finger I'm squeezing?
My index.
Index finger.
Middle.
That's good.
My
Okay. Could you squeeze my finger? Good, good. I'm going to check her capillary refill. That's normal. Check her radial pulse. Good, adequate. Now on the other hand, I'm going to point to a finger and you tell me which. Can you move that finger? Can you move that finger? Can you squeeze my fingers? Good. Radial pulse is good on both sides. Equal movements. Now I'm going to check her lower extremities. For the same thing, still palpate down the femur, patella, tib fib. Check her dorsal pedis pulse, dorsalis pedis. It's adequate. Normal pulse there. Now I'm going to point to a toe and tell me if you can move it. Can you move that one? Good enough. Can you push down on my hand? Good, good. Now I'm gonna check this one here. Can you move that big toe? Okay, good. Can you push down on my hand? Good. So her motor and sensory functions are good. She has no major illness or injury, no bleeding. So there's no need for rapid transport.